Hello there. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. It's high time to tell you about the Editor's Choice and Highlights articles in the September 2016 issue of Mayo Clinic Proceedings. Our Editor's Choice this month is an expert consensus document on new insulin delivery recommendations. The lead author of this article is Dr. Anders Frid from Skåne University Hospital in Malmö, Sweden, and he's leading a very international group of co-authors from Europe, Asia, and America. These recommendations are derived from a large international survey of current practice and were written and vetted by 183 diabetes experts from 54 countries. The recommendations are organized around the themes of anatomy, physiology, pathology, psychology, and technology. The authors hope that adherence to their new recommendations will lead to, number one, more effective therapies and improved outcomes for patients with diabetes, as well as, number two, lower cost. The accompanying editorial entitled Optimizing Insulin Delivery in Patients with Diabetes Mellitus, Still Room for Improvement, was written by Dr. Matthew Drake and Dr. Stephen Smith from Mayo Clinic in Rochester. The authors point out the fundamental clinical importance of the new guidelines for the optimal administration of insulin and the overall care of patients with diabetes. They also discuss the potential barriers to widespread implementation of these guidelines by patients and healthcare teams, such as lack of time to provide individualized counseling and, unfortunately, a lack of perceived importance of the need for optimal insulin injection techniques as a fundamental driver of glycemic control. The first highlight in the September 2016 issue of Mayo Clinic Proceedings is an original article on the risk of women with hypertension and diabetes during pregnancy for developing hypertension and diabetes in the longer term. This article was authored by Dr. Lien Wen Hu from the China Medical University College of Public Health in Taichung, Taiwan, and co-authors from several other healthcare institutions in Taiwan. Based on insurance data from almost 20,000 pregnant women, the authors found that women with hypertension during pregnancy are at increased risk for developing hypertension and diabetes after delivery. The risk of developing hypertension and diabetes after delivery is even greater in women who have both hypertension and diabetes during pregnancy. And in this latter group, the risk of diabetes after delivery is particularly high in younger women. Based on their data, the author suggests screening for hypertension during pregnancy and for gestational diabetes and providing appropriate follow-up and counseling after delivery to reduce the risk of hypertension and diabetes in the longer term. The second highlight in this month's issue of Mayo Clinic Proceedings is a concise review for clinicians on antidepressant-induced female sexual dysfunction. This article was authored by Dr. Tierney Lawrence from Indiana University in Bloomington, Indiana, and Dr. Jordan Rollo and Dr. Stephanie Forbion from Mayo Clinic in Rochester. This is an important topic for the practicing clinician because 1 in 6 women in the United States takes antidepressants, and because sexual dysfunction in these patients can be complex to evaluate owing to the fact that it might represent side effects from the antidepressant or be associated with the underlying mood disorder or both. The authors take the reader in detail through the pharmacological, behavioral, and the complementary and integrative options for the treatment of sexual dysfunction in these patients. You can get up to 1 hour of CME credit for reading this concise review if you complete the appropriate documentation. And I bet you already know that you can access these highlights and editor's choice articles on our website free of charge during the entire month of September. Our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org also has other free content. We update our website often, and there's something new to look at almost every day. If you connect with us on Facebook, Twitter, and YouTube, we can make it even easier for you to stay in touch with Mayo Clinic Proceedings. With our social media channels, we can keep you up to date on online first publications that come out on our website between the monthly issue updates, and on news stories that are related to articles that were published in Mayo Clinic Proceedings. On our YouTube channel, we host all our video content, for example, full author interviews and our 60-second video article summaries. Now, today is the third day of the 2016 Summer Olympics, and everybody has their mascots and their talismans ready. I don't think you've ever met any of the Mayo Clinic Proceedings unofficial mascots. And here are two of them. They've been waiting patiently and quietly in the wings.
Hi, I'm Freya.
Hi, I'm Max. Have a great rest of the summer.
Thank you so much for watching. We'll see you again in October.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.